mental illnesses are a big problem for this country, and statistics show us that one in five people at one point in their life will struggle with a mental illness. And just by projections, the fact that Kenya has an approximation of 56 million people, we can see how many people will actually struggle with a mental illness by the end of their lifespan. It's really a big number, and it's a big burden, and it also causes a lot of disability. Now, Mathari Hospital currently is really trying to do a lot of things and a lot of projects to ensure that we get in as many clients to get care, but also to try and do a lot of other things to improve the branding of this hospital. As you are very much aware, there is a lot of stigma towards clients who have been diagnosed with a mental illness. And the activity that we are carrying out today, which we are very lucky to have gotten very good partners, Karenik and Olea, is a compassionate activity to try and reduce stigma. So they are here to just take care of our patients' hair, braid their hairs for the females, cut the hairs of the male clients, wash them, do pedicures, do manicures, and just by touching and being with our clients in this very special way, that is a way of reducing stigma. But just to talk about the stigma that our patients actually face, one of the things that as a country we can really put resources in is creation of awareness. Awareness to the population and to Kenyans what are mental illnesses. And also just to say that if your relative or a loved one is diagnosed with a mental illness, we should not stigmatize them. In fact, try to get as much information as you can on how to take care of them. I can confidently say that we have medications that work, and a lot of people who are struggling with mental illnesses, there is medicines that can work and take them back to functionality and productivity. But even notwithstanding that, we also have psychotherapy, and we do have psychologists who can also assist clients who are struggling with mental illnesses or psychological distress, just to take you back to a state of functionality. So a lot of things are now being done by the government, and we have even school health, whereby education is being done within schools to just ensure that we capture students, even at their young age, in just making sure that they are aware about mental illnesses, and also that they are able to go for care on time. Yes.
Thank you very much.
We realize there's a need for these activities because we need to bring back dignity to the patients. Being a mental patient, when you have a mental illness, doesn't mean you have to look like it. You do not have to look a certain way. So we are here to help them just do their hair, do their nails, bring back their confidence and self-esteem. There's a huge gap, there's a huge need. And as an organization, we're only getting support from friends and families. For this particular event, this is the fourth event we are doing here. We've had support from two organizations, that is Olea Africa and Karenik Beauty College. And we are asking for more partnerships from other organizations, NGOs, corporates to come on board and help us just light up the patients' lives and just bring back that smile. Mental health is something that is very serious in this country, and we can see the need arising. We have issues coming up every single day. We must have a mental illness case. So if we come together as a community to support these patients, we are going to go a very long way to make sure the patients live a dignified life and can be respected in the society.